Okay, so now I would like to introduce Dr. Wagner, and he is going to be leading our presentation on genetics relating to hearing loss. And Dr. Wagner, would you please take a moment to share a little bit more about yourself with us?
Sure. I work at the University of Chicago. I'm the director of medical genetics there and the director of 2 laboratories, clinical testing laboratories for molecular and cytogenetics. I see patients with and families with all kinds of genetic issues and questions. I trained in pediatrics after medical school. I went to med school at Washington University in St. Louis. Trained in pediatrics at the University of Chicago after that, and then did a postdoctoral fellowship in the lab in genetics at WashU, and then have been at the University of Chicago since 2000. I'm, as I said, involved, and I see both children and adults. I participate in research, not surrounding hearing loss specifically, but I do genetics research and teach in the medical school and undergraduate level and graduate school level, and that's sort of who I am, what I do. So I guess what I would do is just give sort of a brief introduction about the genetics as it relates to hearing loss, and then more or less be happy to answer as many questions or questions that people have about more or less whatever. In general, most children who are born with a form of hearing loss, the vast majority of them are because of genetic causes. There are environmental causes that can lead to hearing loss, things like infections, being born prematurely, exposure to oxygen, and things like that. But the vast majority of children who are born with hearing loss is due to a genetic cause. There are many, many different types of genetic causes that have hearing loss associated with them. So in general, it's thought about, broken up into different categories. One category is considered isolated hearing loss, where the only medical problem that a child or an individual may have is that related to hearing loss, whereas some individuals are born with multiple medical problems and have other birth defects and other medical issues and other medical things going on in association with hearing loss. And so those would be considered 2 different categories, isolated or not isolated. Syndromic sometimes is the word that's used in the category of other medical problems. The numbers will change, and you'll see different things, but roughly about 30% or so of hearing loss is syndromic, meaning associated with other medical problems, and the remaining 60–70% is isolated. For individuals with isolated hearing loss, then we think about that being divided into different forms. There are hundreds of different genes that have been discovered that when there's a genetic change in the gene that alters the normal function of that gene, it results in hearing loss. Those genes can be divided into inheritance patterns, and so then they're thought about in isolated form being in different inheritance patterns. So there's some genetic mutations where an individual inherits 2 genetic changes, one from each parent. Neither parent has hearing loss because they only have 1 genetic change, but then when both genetic changes, one from mom and one from the dad, come together in the child, causes hearing loss in the child. That's considered autosomal recessive hearing loss. And in that instant, a family who has oftentimes no history of hearing loss can have a child with hearing loss and also be at risk of having more than 1 child with hearing loss. Another form is considered dominant, where that an individual with 1 change has hearing loss. So this is more common that you see family history of other individuals in the family outside brothers and sisters, so moms uncles or grandparents who have hearing loss. It's inherited in the family. And then there's some other kinds as well that are rarer, but those are sort of the main ones. So in at least at some places, I don't know necessarily that it's commonplace at every evaluation that a child or an individual who's diagnosed with hearing loss typically sees an audiologist and an ENT, and at many of those places then the ENT will refer the patient or individual or family on for genetic counseling or genetic testing or more information about genetics. That's the part I don't know that it occurs everywhere. I think there's probably people who have had experiences where they've been involved with ENT and audiologists and genetics may not have come up. But in general, when a child is referred or an adult or an individual is referred to see me, we go through that scenario that I just described. We take history from the individual, try to determine if there's other medical problems or issues that may have been responsible for the hearing loss, or if there are other medical history or information that could be associated with the hearing loss, so some form of a syndrome that is putting together multiple issues together with hearing loss, or if it's isolated. And in the setting of isolated hearing loss, based on family history and other information, try to help individuals understand more about family counseling, recurrence risks, what those informations might mean. We discuss with individuals the opportunity for genetic testing, so by blood draw, so you can draw a blood sample from an individual and isolate their DNA and genetic information and do genetic testing. So that part's pretty straightforward, getting the blood sample. Genetic testing is, as I said, there are many, many, many different forms and genes. So there isn't just an easy single place that you can test every known genetic cause of hearing loss. So there's multiple places where testing can be performed. And there's multiple strategies that people use. There's issues with insurance coverage and whether your insurance covers testing or whether you need a letter of medical necessity that can help insurance to provide coverage. And there's options of sort of testing the most common forms, which are single gene tests. Now there are more sophisticated options where you can get panels of genes, and there's up to 20, 30 different genes that can be tested at one time. And so typically you'd be, someone would bring those kind of issues up, talk to individuals about how genetic testing could be useful, insurance coverage issues, individual scenarios, and make decisions with families or individuals about whether they want to pursue genetic testing. The benefits of having a genetic test that comes back positive, so defining the cause of the hearing loss, can be that in a form where there's associated medical problems, that you can now learn what other medical problems that you need to think about or be aware of or plan for in the future. Oftentimes the specific genetic cause can give treatment indications about whether cochlear implants are appropriate or what other kind of hearing options that you're considering. And then, as I mentioned already, family recurrence information about if there's a family history, understanding more about what that is, or if there has been no family history, understanding more about is there a chance that you could have more than one child with hearing loss. For the individuals who have hearing loss, what is the genetic basis can help define if their children will have hearing loss. So those are some of the typical ways that we would approach a patient or an individual, and some of the things that we would go through, some of the scenarios that we would go through. I don't know if you want to, if there are questions about that, or if you would like me to elaborate further on any specific point of those issues.
I had a question. This is Jim. So if you said there's hundreds of different genes, why would somebody only get a panel of like 20 to 30 genes?
Well, so that's a great question. Mostly it has to do with availability of clinical testing. So in order for a physician to order a clinical test on you or your family member, and for that to be covered by insurance testing, it has to be done in a lab that is certified by agencies within the federal government called CAP and CLIA. And so CAP and CLIA is sort of the branch of the FDA that says that if your doctor orders a test on you, that it's being done in a manner that's been certified to be correct and accurate. And so there are only a limited number of places around the country who do genetic testing under CAP and CLIA certification. So your access to the number of genes that you can get tested is limited to the ones that are being offered by the clinical labs. And oftentimes genes are found that cause hearing loss in a single family, and without knowing anything more about how frequent they are in the population or how many other people have this as a genetic cause, then labs don't include those in their panels or offer testing on them because there's no information about how frequent they are. So those are some of the factors that go into what kind of access to testing that you have, as well as there's a cost-related issue. The cost of genetic testing is coming down, but ranges from anywhere from about $400 to $1,000 per gene. So the cost is coming down. We could offer a panel of 20 genes, can cost up to $10,000. If you wanted to offer 40 genes, then it would cost twice that much. So those issues come into play as well at what laboratories offer as far as frequency. They try to pick more common genes, genes that have more informative information from a clinical standpoint to put on their panel. So it's not 100, it's not foolproof or it's not 100%. But those are some of the issues that go into the decision making.
Okay, no, that helps. That was my next question, was the cost of it. Do you typically find that insurance companies are kind of hesitant to pay for such testing?
No, our experience is very positive. So we rarely run into a scenario where an individual insurance provider won't cover genetic testing at all. There's a few exceptions. So Medicare does not cover the cost of genetic testing. So typically, though, most people who have Medicare are older individuals. And even if you have Medicare with a secondary provider, your secondary provider follows the rules of the Medicare. So genetic testing is not covered under Medicare, so your secondary provider wouldn't cover it either. For any of you who have children with hearing loss, and most of your children would either be covered under your insurance or Medicaid. Medicaid actually covers genetic testing, but reimburses at a very low rate. So if a genetic test costs $600, Medicaid pays about $50. So if your doctor's office or hospital that you're working with ordered a test, it would be covered technically by Medicaid. Costs $600 that somebody has to pay, the hospital pays, and then Medicaid reimburses them $50, so the hospital sort of loses the rest of that money. So for that reason, some hospitals restrict genetic testing on Medicaid patients. But for private insurance, we, for the most part, with only a rare exception, have luck. I would advise anybody who's considering having genetic testing that you first check with your insurance. Once you know what kind of test you're going to order or what kind of panel that you're going to order, the laboratory that's doing that test provides something called CPT codes. They're billing codes, and these you can find the CPT codes from the laboratory that does the testing, and then you can check with your insurance company about their policy for coverage of tests with these individual CPT codes. recommend that you do that before you get the test. Because in some instances what we find is the insurance company says like, well, we would need a letter of medical necessity for coverage of this test with those CPT codes. So if you've already done the test and the bill's already been paid and you're now trying to get the insurance to retroactively cover that, they're very resistant in that scenario. But if you proactively, before the test is done, check with the insurance coverage and they require medical necessity, and you get that letter of medical necessity first and then get the coverage approved before you get the test done, then we've not had any problems with that. And I would say maybe 1 out of 5 or 10 times we do need to provide a letter of medical necessity for the insurance company, but that means, you know, a lot of the times, 80% of the time, it's covered. Now that's different for every person's insurance plan. So if you have a deductible of $5,000 and you haven't met that, then if the genetic test costs $1,000, then you're still going to pay for all of that as part of your deductible. Some people's insurance, they have to pay a certain percentage, so it's always worth knowing how much is this test, especially with these large panels now, which are upwards of $5,000 to $10,000 in cost. So if you have to pay 20%, then knowing that in advance that 20% of $5,000 is still a pretty significant amount of money. So those are the kind of issues that I would recommend people consider when they're thinking about having genetic testing done and finding out about.
Yeah, that answered my questions. I appreciate it.
No problem.
This is Carrie. How long does it take to get results back on genetic testing, typically?
Well, unfortunately, there's no single answer to that question. So, again, it depends a little bit on which test that you have done. So, up until recently, the way most testing was done was most of genetic testing revolved around Connexin 26. I don't know if people have heard about Connexin. So of all the different forms of hearing loss, the isolated form of hearing loss that was under the recessive model that I described, where both parents would be carriers of a genetic change but have hearing, but then when the child got 2 copies of the genetic change and led to hearing loss, of all the genes that have that model of hearing loss, there's one gene called Connexin 26, which is the most common form of autosomal recessive hearing loss. It's estimated that it accounts for about 20 or 25% of congenital hearing loss, although it seems to me as time goes on that might be an overestimate. But so for a long time, the sort of testing focused around just having Connexin 26 done. So if you had a test for just Connexin 26 as an isolated gene test that costs about $400, and the results could be back in about 4 weeks. Now, as technology has improved and as more and more genes have become available, and now these panels of genes where they're testing for 30, 40, and 50 different genes, those take up to 3 or 4 months for the results of those tests to come back. So it depends a little on what test you're getting and how in-depth it is, and as to how long those results take.
Thank you. This is Carrie. I have one more question. So who would have their blood drawn? Would it be just the child, or would it be the parents too?
No, so typically we would start with testing in the person with hearing loss, so whether that was an adult or a child, but the individual with the hearing loss would be the first person tested. And then once, if genetic testing was to identify the specific genetic basis of the hearing loss, then again, sort of under a genetic counseling session where you meet with, at least in my clinic, where you would meet with one of my counselors and me in a follow-up session, then we would talk about other members who would want to consider having testing done within your immediate family, but even amongst, you know, the rest of the family, as far as aunts and uncles and people like that that might benefit or want to know, and then typically we would help write a letter that you could share with other individuals in the family to say, like, here's the story you might want to consider finding out, and sort of help with those things. But the first person to be tested initially would just be the individual with the hearing loss. And the reason is because still, despite all these things that I have described, there's still a significant number of individuals who, even when they get the expanded panels, we don't find the genetic cause of their hearing loss. As we mentioned before, there's hundreds of genes, and even the panels with the largest number of genes don't contain every known gene. And so if we can't find the genetic basis of the hearing loss in the individual with hearing loss, then there's no real reason to test any of their other family members, because we wouldn't be able to find it in them either.
Thank you. Any other questions out there? I've got more, but I don't want to hog the line.
I have a question. This is Melissa.
Okay.
How often would you say that happens, that someone has genetic testing for hearing loss and they can't really find the reason why?
I would say if you've had testing for only the gene connexin 26, then as I said, that maybe about 20% of hearing loss is accounted for by connexin 26. So a significant proportion would be negative in the setting of only testing that single gene. Under some of the larger panels, it isn't quite clear to me yet how many individuals. But my guess is going to be that the larger panels are going to find an answer in 40, 50% at most. So that still means about 50% unanswered, or the specific genetic cause, not necessarily discovered at that time. These panels, now that the technology has changed, allow us to do a larger expanded number of genes in the panels, will also allow the more genes to be added on easier, faster, and cheaper. And so the panels will probably continue to grow rapidly, so that will likely change very rapidly now, as opposed to previously where it was changing slower, but still somewhere in that range.
Thank you.
There are other things that can be used or that can be helpful. Oftentimes individuals have a CT scan of the inner ear, which is a CAT scan, where they look at the inner ear structures and their changes and malformations of the way the inner ear is formed that can give clues as to specific types of genetic forms of hearing loss, but in other instances are associated more with non-genetic or at least non-known genetic causes of hearing loss. So that CT scan can sometimes give useful information. Other things that are commonly thought of in the setting is an eye exam, which is typically more useful in a little bit older child. So usually not in a newborn, but 1-year-old or 2-year-old, or especially 5-, 6-, 7-year-old child. An eye exam can be useful in thinking about different genetic causes. Sometimes individuals might have gotten or hear about getting an EKG, which is an electrical measurement of heart conduction. So it's probes that are placed on your chest and sort of measures the electrical beating of your heart to make sure that everything is in an ordered fashion. And so those are other types of things that sometimes get ordered not necessarily by the geneticist, but maybe by the ENT doctor. That, depending on what they show, might be beneficial in directing sort of what specific genetics to think about as well. Are there other specific questions that people want to ask about their own experiences, or how many people have actually met with a geneticist? Has anybody
this is Melissa. I've met a geneticist twice for my daughter when she was born.
Okay. But it sounds like a significant number of people on the call maybe haven't had to come up or didn't have that opportunity.
This is Pauline. It's never been brought up to us to have genetic testing for our daughter, and she's adopted, and we're trying to decide if it would give us any information, or for her any information in the future, if it would even be beneficial for her to do. But it's never even been given to us as an option.
Well, that's a good thing to think about. So, in my mind, at least, there's sort of three broad categories of how genetic testing can be useful to you. So one is for as parents who have a child with hearing loss, and thinking about having additional children and whether they might have hearing loss. And it can be useful in that setting. So obviously, for an adopted child, that category isn't as useful. The second category is the individual with hearing loss themselves, and what are the genetic issues as far as for their own children when they grow up. And I would say in that setting that it isn't useful to do genetic testing in a very young child to try to identify what their issues, what their risk of having a child with hearing loss as adults are. One, young children don't appreciate that information. They aren't considering it. Two, the state of genetic technology, as we stated now, if it discovers 50%, it means there's still 50% that aren't going to be discovered now, but in 20 years, that will probably be dramatically different. So might as well wait and get the most useful information. As well as it would be important for the individual themselves to make that decision. As far as using genetic information to find out about their own recurrence risks, it should be hopefully a choice that they would be actively participating in. And then the third broad category would be about other medical problems that an individual might be at risk for. So that would be the big one, is sort of trying to define a genetic basis to see, is it isolated hearing loss, or are there other medical issues that a child or individual might have to worry about or think about over their lifetime in addition to the hearing loss.
Thank you.
This is Carrie again. So it doesn't sound like age is really important as far as when to get tested, because we were kind of in the same boat as Pauline, where it was never suggested to us. And so now he's 12, and you sit and you think of the possibility of the future, and you wonder, should we, or should we just let it be?
Right. So that's a good question. So I would say that age does have a role. There are some genetic conditions, like one that I'll mention is called Usher syndrome. And this is a genetic syndrome that has other medical issues besides hearing loss. And the other medical issues can be those related to balance and development, so that individuals are slow to walk and have balance-related issues. And so in a 12-year-old, you wouldn't still be wondering about those issues. So their age would make a difference. In a younger child, the genetic testing might give you more information, so that as a child if they had Usher syndrome, you would know to get them more developmental services and to focus on those issues for them and help them. Whereas in a 12-year-old, you weren't really worried about those kind of developmental issues anymore. So that's one example how age would sort of make a difference in some of the decisions that you would make. So for any of the genetic bases that have other medical problems, if those medical problems specifically are ones that have onset earlier than the age of your individual child, then right, it wouldn't make, you aren't sort of testing for those things, but some of them can be later onset issues, and then they still could be things that might be beneficial to learn about.
Hi, this is Anita. I have a question. So I was just curious. I'm wondering, is there, I guess, any individuals out there who have a genetic, I guess, hereditary gene that eventually, I guess, shows up? Because I know within my family, my mother and my father and myself have a hearing loss, but it didn't happen until later on in life. So I'm just wondering, you know, I do have 4 kids, and one of them was born with a hearing loss, but for my other 3 kids, they do have good hearing. They've had frequent hearing tests done, but I'm afraid that as they become older, you know, they're going to start losing their hearing, and I'm wondering, okay, who picked up that gene? You know what I mean? So is there any way to find out early on in life to see if they're prone to that?
Well, so no, that's a great question. It has several different issues. So one is that it's important to point out that hearing loss isn't the same in all individuals or in all families, and a significant proportion of hearing loss is congenital, meaning from birth, but there are many forms of hearing loss which are progressive over time, and so they don't present until later in life, and they can get, some can be static, meaning whatever hearing loss you have is sort of stable and doesn't change. Others can be progressive and get worse with time. So they aren't the same in individuals, and a lot of that difference is determined by genetic factors. So there are genetic forms which are known to be later onset and to be progressive. And in that case, yes, if a genetic form is identified in the family, then you can use genetic testing once you know the genetic form in a family to test like younger children to see who's inherited the genetics and who hasn't, so that you know. And the benefit of that would be for individuals who you know didn't get the genetics, then you wouldn't necessarily need to have the progressive hearing test in them. And if you know that they're not at risk, and then the individuals who are, then you do follow them more aggressively. So that's how it can be beneficial, but also one would have to consider carefully if that's information they want to know. And that's also different from family to family. So there are some families who want to know that information and want to be proactive and act on it, which is fine. And there are some families who decide that, you know, time will tell, and our children will be who they're going to be, and we'll find out, and that's fine too. And so there's no right or wrong from that standpoint, but just like the diseases can be very different from one person to the next, the way families think about or want or utilize genetic can be different as well. So those are all considerations that have to come into play.
Yes, thank you. Because if you don't mind, I do have another question.
Sure.
It's the same person, Anita.
Okay.
So I just find it to be a little odd that, you know, because of this genetic
testing me and my parents
have, you know, have gone through, you know, of being able to hear, and then through time, you know, we start losing that hearing, and this happens later on in life. But I guess the thing is, I do have a sister who was actually born with a hearing loss, a profound hearing loss, and then she married a hearing man, and all 4 of her kids were fine, and they have perfect hearing. So I'm just curious, out of my 4 nieces, I mean, they're all hearing, and the mother was born with the hearing loss. What are the results for their kids? I mean, did that gene get skipped with her offsprings, I'm wondering. So what is your experience on having something that's prone or genetic in the family skip a generation?
Well, so I'm not going to be able to tell you just sort of over the phone exactly the scenario for you and your family, but one thing is that even within families, the same genetic form of hearing loss doesn't always cause the same degree of hearing loss. So, and there's a lot more experience and a lot more, at least, commonly amongst ENTs and geneticists, as opposed to people who focus 100% on hearing loss, a lot more experience in congenital hearing loss. So the vast majority of patients that I would see in my clinic have congenital hearing loss. I've seen far more of them than I have of adults with later onset hearing loss. And then even in the gene I was mentioning before, connexin 26, which is the most common, it typically causes severe congenital hearing loss that's non-progressive. But there are some individuals who lose their hearing at age 2 with connexin. There's some individuals who do have progressive loss with connexin. So that even though that's the most common form of severe non-progressive hearing loss, there's some individuals with the same gene cause that react differently, and their hearing loss is different. So even with the same family, I think that it, I don't know for sure. There's a possibility that in your sister who had early onset hearing loss, it's the same genetic form, it just reacted differently in her. In that setting, there isn't 100% chance that her children or your children would inherit it, and it's possible that you could have 5 children and none of them inherited the genetics, or that if they did, that the hearing loss could still be later onset in their child, even though it was at birth in them. There's a lot of variability in that information. And it isn't, unfortunately, uncommon to have undergone genetic testing and for
because I know that I've lived
not to be found.
Because I've lived long enough to know that with my niece. I guess with my niece, I've watched her grow. I've watched her since birth, and I've always kept my eye open to see, if that was something that was going to pop up in her. So it's curious to watch them grow and see what happens.
Sure.
Okay, well, thank you.
Okay.
This is Ramona. I also have a question. We have 2 little boys that have hearing loss and 2 children that don't. There are 2 participants, 1 from each set have the hearing loss. We just went through the University of Iowa, their genetic study or their genetic panel. Actually, I think it was back in March or April of last year, and we just got a call on Thursday of last week that it's the SPRC gene is the one that has a mutation in it for both of my boys.
Okay.
So where can we go now that we have an answer and it's typically not progressive? That's all that they can tell me. So where is there that we can go to get more answers or see if there's other, what we need to do for our other 2 kids, or if there's any other effects that they might have, or anything about whenever we get answers from genetic testing?
Well, so probably the best thing to do now, who ordered the genetic test for you?
Their pediatrician.
The pediatrician ordered it?
Mm-hmm.
So now I would ask to get a referral to go meet with a genetics doctor or genetic counselor here locally. I'm not familiar off the top of my head with that specific gene, but if you called my office and said, hey, my pediatrician ordered this test, and now we want to try to learn as much as we can about it, then we would get the results of the test from you before you came, so that we could then go look this up and familiarize ourselves with the literature and the results and be prepared to help you answer all those questions when you came in. What is the inheritance pattern? Who else could be carriers, or how does that work? Or what is known about the medical issues related with the hearing loss, and help direct you to some of that information. So almost anywhere in this, there's many places in the state of Illinois where you might live that there isn't a geneticist in the local area or town, but there are usually genetic outreach clinics that you can access fairly, not too far away. There's clinics in Peoria, there's clinics in Rockford, in St. Louis, obviously many in Chicago, Madison, Wisconsin. Those are the places I can think of sort of off the top of my head. So that's, even though some of those places can still be far away, usually you can get access to find, a genetics clinic, but you might have to talk to your pediatrician about getting a referral to one of those places depending on where you live.
Okay. Thank you.
Those are all great questions. If people have other things they want to talk about or bring up or discuss, or
this is Yolanda. I have one question on, as far as prior to doing genetic testing, let's say you have a child that just has hearing loss, and as of now that's just been the only thing that has shown up. What's the percentages per se of if you did genetic testing that something else would pop up there?
You mean what percentages is there a genetic cause that has other medical problems associated with it?
Right, because
what you're asking?
Right, because we are going back and forth saying,
right.
He doesn't have anything else.
Sure. Should you go look for something else? Well,
right.
So the statistics is about about 60 or 70% of the hearing loss is isolated. So meaning no other medical problems, and about 30% is associated with other medical issues. Now, of that category of the 30%, a lot of those medical problems are ones that you would already know about. There's, Down syndrome can have hearing loss. So it's in that 30%, and you would already know whether your child at this point had Down syndrome. So of that 30%, and that's just the overall statistics for all congenital hearing loss. 60 or 70% is isolated and 30% syndromic. So now for you, depending on how the age of your child, obviously that would be shifted a little bit. And it would be harder for me to sort of give you then a specific number even based on age, because that kind of data isn't necessarily available. But so, but certainly no higher than about 30%. And then if you had, like a previous person asked a question about like a 12-year-old with no other medical issues, then now that number would be significantly less than 30%, because now by age 12 you already know that there's all, the child's doing fine and all other issues. The bigger unknown would be is sort of in a newborn, where you don't really have 12 years of information to tell you that things have been going fine.
He's almost 5.
Sorry?
He is almost 5.
Almost 5. Well, and if his if his other development is fine and he hasn't shown any other medical problems, then again, the likelihood of being in that syndromic category is certainly much less than 30%. But it would be hard for me to give you an accurate number to say in that case.
Okay. Okay. Thank you.
This is Carrie. So if there was a family that was kind of on the fence and unsure, maybe they feel like they might have missed their opportunity, but they're still curious, would you suggest a consultation with a genetic team, or would you suggest talking to the pediatrician? Where should they go from here?
Well, no, I think if no matter what the age of an individual, if it's something that you're questioning or that you want more information about, then I definitely think that you should go meet with a geneticist. I mean, I think it's also perfectly reasonable that people have been talking about, like, well, my child has been doing well, so we're not pursuing a lot of genetic testing, and that's fine. There's no issues with that choice. But if it's someone where you're thinking, well, I would really like to know a lot more, or I would like to find out more, then definitely you should go meet with a genetics person or an ENT doctor who has a lot more experience with the genetic basis. And many of them do not, so that would have to be only a few ENTs that I know of at least. But your pediatrician isn't going to have a lot of information about the specific genetic nature and to answer some of these questions. They just, you know, the general pediatricians just don't have, you know, they're not that specialized. So I think for someone who is questioning or has questions they would like to have answered, would like to learn general information, and a lot of the general information that you would get from a genetics consult is like some of the things we've been talking about on the phone. So maybe that a lot of this information I've given you is enough to answer your questions. But if you still have more, want to, you know, have thought about specific testing or how it could be right for you, or what are the options or the considerations, then I think it would be worth pursuing.
Excellent, thank you. Well, our conference line is held till 9:30, so we're going to have to wrap things up. But if a family wants to get in touch with you or your team, maybe to follow up or to look at genetic testing, what would be the contact information that you'd be able to share with us so they can get in touch with you?
Our phone number is 773-834-9110. And I work with Dr. Suskind, who is the ENT doctor at the University of Chicago. And I don't know Dr. Suskind's number off the top of my head. I apologize. But I suspect if you searched her cochlear implant program on the website for the University of Chicago, you could easily find her number, and then she could always put you in touch with me as well. That number is my office number, clinic coordinator who answers the phone, who could direct to a genetic counselor for a question on the phone, or to schedule an appointment, or to find out information like that. Then that's the way to get in touch.
Excellent. Well, thank you so much for your time tonight. We really, truly appreciate it. And I took plenty notes. And I've already had multiple requests for the recording from families that haven't been able to join us live tonight on the call. So again, thank you for your time. Thank you all for calling in and the great questions. And I'll catch you all next month. Thank you.
Thank you. Thank you.
Thank you.
Thank you.